Okay, Assalamualaikum and good day everyone. We will continue with Unit 7, which is the last unit for this course. Topic is healthcare worker roles. Learning outcome. The first one is to critically evaluate current infection control practice, considering the impact on patients, staff, and carriers or visitors. The second one is to analyze the importance of leadership and change management in implementing evidence-based practice in the prevention and control of infection. And the third one is to describe the role of the infection control team in the prevention and management of healthcare acquired infection. This is a rather quite a short topic. All right, so as an introduction, looking in a bigger perspective in terms of infection prevention and control, the responsibility for the prevention of the disease or prevention and control of the disease or infections does not only rest with the infection prevention and control team alone. It's actually everyone in the healthcare system. So everyone in the clinic, everyone in the hospital are responsible to prevent or control the infection. Okay. Um, and then it is actually an organizational responsibility in the patient-centered care to ensure that every aspect of infection prevention and control in patient care are practiced all of the time amongst all staff. So the institution, if we're looking at the bigger facility like hospital or university that has hospital or clinic, they need to have some sort of governing team to monitor or to ensure all aspects of the infection control are taken care of. As for the evaluation of current practice, as a staff in any center or in any facility, you have to check the available regulations. Once you move to a new place, you might want to check the available regulations pertinent to infection control and prevention. What do they have in every facility? They should have some sort of policy, some sort of guidelines or regulations that they use in patient care. And then you need to know also the type of facility that you're working with. You know, each facility type would have a different type of guidelines too. And then you need also to evaluate the risk involved when you are working in that particular area. So every area, every place, or every practice or facility has some sort of different risk involved. Okay. Um, Also, when you are evaluating the practice, please ensure that you have discover or you do know the procedures manual that has these policies and procedures regarding cleaning and decontamination of surfaces and equipment, procedures for isolation of patients, management of spills, hygiene and hand washing procedures, using of the PPEs, safe handling and transport of the pathology specimens, handling, cleaning of contaminated linen, disposable clinical waste, disposable of sharps, and also definitely management of sharps injuries. So all of these are actually included in the infection prevention and control manual that every place need to have. You know, this what you're gonna see um, with the big hospitals or any bigger facility. Whereas if you are working in a small facility like a small clinic, you probably don't have all these, but you're going to follow the governing body of the country that come up with this. For example, in Malaysia, we have the Ministry of Health guidelines and also policies that you could probably follow um, as your guidance. We move to leadership. Okay, in infection control, leadership is very, very important because leadership make things run. Okay, make sure everything's running smoothly, everything is well enhanced or under control. So for a bigger organization like a hospital or institution, the manager or the trained doctor shall lead a team by assigning roles and responsibilities for infection control throughout the organization with a clear line of accountability and delegation. Means that they need to have a team that manages the infection prevention and control. But for a smaller clinic, like what I mentioned before, the owner itself or the dentist or doctor should play an important role to ensure all aspects of infection prevention and control are observed among all the staff. So they have to make sure that the nurse, the hygienist, or the dental assistants, or even the receptionists do know about the infection prevention and know what to do in every situation. Okay. All right. The last bit of this very short lecture is looking at the infection control team. So I have mentioned before about the a team that manages infection prevention and control in a bigger facility. So for an organization or institution, or I mean, for example, hospital and university, there will be a group of personnel handling the infection control issues. Okay, whereas for the small one, the owner or dentist, as I mentioned before. So for the infection control team, the team should represent by many portfolios. First one, definitely physicians. Number two, nursing staff. Number three, infection control practitioners. Number four, quality assurance personnel. Number five, risk management personnel. And number six, actually from the each of the department, perhaps, definitely from microbiology, surgery, central sterilization, environmental services, and etc. These people are part of the team, but these team actually headed by someone who are able to make a decision, someone who is able to make a secure the funding so that everything about infection prevention control run smoothly. So normally for this setup can be seen in hospital. Normally this setup can be headed by the head of department of certain services or even the director of the hospital himself, him or herself. Okay. So just showing you the rules and responsibility of the team. Looking at this, you can see they are actually doing formulation of the infection control policies and guidelines. So they can come up with the policies and guidelines in that particular institution, but they have to observe also the existing law in the country and also regulations by the governing bodies. They are responsible to educate the healthcare personnel, either formally or informally, and they need also to monitor the practice in the hospital or in the institution, definitely also the standards of care. They also need to know or to identify the risk situations and advising on the correct placement and care plan for the infected or vulnerable patients. Number five, liaising with occupational health department to ensure that staff receive appropriate advice regarding the healthcare and possible infection risk at work. They also can be a prime investigators during an outbreak. All right. Number 7, advice on closure of wards or facilities for infection control purposes. This when occur when they detect something being transmitted in a certain facility, they can close for cleaning or for investigation. Number 8, creating effective lines of communication between wards, departments, managers in the hospital, and community, the microbiology department and infection control committee as well. These one just to make sure that everything get the same information or talking at the same language. Okay. Number 9, being active members of the policy review groups in the bigger perspective in the hospital. Not just for infection control, but they're also part of the bigger team for the policy in the hospital and any other relevant groups and committees. Okay. The last one is initiating or participating in research-based activity. So as you can see in the hospital, they do some research as well, and the team can be involved, especially when they are looking at the quality of the water, the quality of the air. They're looking at the instruments. If they can find any relevant information that they can take action upon with. Okay, I think that's all for now. Thank you.